لكن باقي ما باقي خاصة الساينز السيمتومز الكرايتيريا وهاي الأمور الأساسية اللي راح أركز عليها أكيد مطلوبة. بسم الله. شو هو المود؟ Mood is a pervasive and sustained feeling tone that is experienced internally and that influences a person's behavior and perception of the world. The affect is the external expression of mood وأخذنا هاي الشغلة حكينا فيها في لقاء سابق. شو القصة؟ جنين مسكينة مش قادرة تشبك. Okay. As you all know, mood can be normal, it can be elevated, or it can be depressed. بالله يسكروا المايك لو سمحتوا. اللي المايك فاتح عنده يسكروا لو سمحتوا. Healthy people feel in control of their moods and affects. زينا احنا كلنا يعني we can control at least يعني if we cannot control the mood, we can control the effect, the external expression of our mood. Hence the definition of mood disorders. They are a group of clinical conditions characterized by a loss of that sense of control. People no longer are able to control their affect, their mood, characterized by a loss of that sense of control and a subjective experience of great distress. الجنرال symptomatic patterns اللي بنشوفها بكل المود disorders حطيت بالصفحة هاي حاولت ألخصهم. شو مشكلتها جنين المسكينة؟ جنين أنت معنا؟ شبكتي؟
دكتور هيني دخلت كان بس مع اللابتوب.
تمام. فالجنرال patterns of symptomatic patterns للpeople with mood disorders. أولاً patients with elevated mood usually طبعاً it's not a rule but usually demonstrate expansiveness, flight of ideas, decreased sleep, and grandiose ideas. On the other side, people with depressed mood برضو usually not a rule. They experience a loss of energy and interest, feelings of guilt, difficulty in concentrating, loss of appetite, and thoughts about death and thoughts of suicide. Well, we have also other signs and symptoms of mood disorders, which include changes in activity level, cognitive function, speech, and biological functions. For example, sleep, appetite, sexual activity, and other biological rhythms. Well, these disorders result in impaired interpersonal, social, and occupational functioning. يعني it's not only feeling sad or low energy or guilt أو بالعكس decreased sleep. Not only that يعني because from time to another يعني for short periods of time we all experience some of these symptoms in one way or another. But to make a disorder, to make it يعني a clinical malfunction, these disorders result in impairment. Interpersonal aspect, a social aspect, and occupational functioning. يعني the person can no longer function in his job, he can no longer function in the society, and even he can no longer maintain his interpersonal relationships. سريعا هاي مش الكلاسيفيكيشن الرسمية، هاي أنا حطيتها هيك عشان تفهموها أبسط. When we are talking about a unipolar mood disorder, in other words, we are talking about depressive disorders. And they include major depressive disorder and dysthymic disorders. When we talk about bipolar mood disorders, we are speaking about bipolar 1 disorder, bipolar 2, and cyclothymic disorder. من ناحية الetiology classification, we have substance-induced mood disorders, and we have mood disorders due to another general medical condition. خلينا نبلش ب the يعني hallmark of mood disorders اللي هو major depressive disorder. بالدي اس ام 5 we have specific criteria to diagnose a person with major depressive disorder. وهاي الكرايتيريا كالتالي. أولا A, we have to have 5 or more of the following symptoms اللي لازم تكون موجودة present يعني for the same 2-week period and it represents a change from previous functioning. At least one of the symptoms is either أولا depressed mood وثانيا loss of interest or pleasure. طبعا they do not include symptoms that are clearly attributable to another medical condition. يعني anything else, any other condition, it has to be excluded. فمنبلش. أولا depressed mood most of the day, nearly every day, as indicated by either subjective report, يعني he feels sad هذا person, empty, hopeless, or observation made by others, يعني appears tearful أو seen crying and whatever. لازم نعرف كمان شغلة إنه in children and adolescents هاي changes it can be irritable mood. يعني هو he might be feeling sad and empty whatever etc. but يعني subjectively objectively عفوا it can be irritable. فهاي لازم نخليها بين الاعتبار. Markedly diminished interest or pleasure in all or almost all activities most of the day and nearly every day, as indicated by either subjective account or objective observation. 3. Significant weight loss when not dieting or weight gain. For example, a change of more than 5% of body weight during 1 month, the last month, or decrease or increase in appetite nearly every day. بالchildren طبعا ممكن هاي التغيرات ما تكون ملحوظة زي ما هي ملحوظة عند الكبار ف we have to consider failure to make expected weight gain. 4. Insomnia or hypersomnia nearly every day. 5. Psychomotor agitation or retardation nearly every day and it has to be observable by others or not merely subjective feelings of restlessness or being slowed down. يعني مش إنه والله أنا حاس إنه يعني خلينا نقول يعني agitated أو بالعكس إنه I feel retarded or slow وإلى آخره. This sign has to be reported by the people who live with our patient, who surround him, who work with him وإلى آخره. إنه something it is visible by others. 6. Fatigue or loss of energy nearly every day. 7. Feelings of worthlessness or excessive or inappropriate guilt. يعني إحنا كلنا بنحس بالguilt from one time to another, but هنا it has to be excessive, it has to be inappropriate, which may be delusional, by the way, nearly every day, and not merely self-reproach or guilt about being sick. 8. Diminished ability to think or concentrate, or indecisiveness, in other words, nearly every day. وبرضه either by subjective accounts or as observed by others. Believe me, يعني, when we are talking about a classical, clinical, major depressive disorder, most of these changes are observed by other people. 9. Recurrent thoughts of death, and not just fear of dying, which we all of us experience. No, هنا recurrent thoughts about death and recurrent suicidal ideation without a specific plan or a suicidal attempt or a specific plan for committing suicide. يعني زي ما حكينا احنا كلنا بنفكر بالموت، احنا كلنا بنخاف من الموت وبنحاول نبعده قدر المستطاع. هنا هاي thoughts are recurrent and they are really serious وتتطور إلى acts. هذولاك اللي حكينا عنهم اللي هم الكريتيريون A. هسه B. The symptoms cause clinically significant distress or impairment in social, occupational, or other important areas of functioning. C. The episode is not attributable to the physiological effects of a substance or to another medical condition. زي ما حكينا لازم تكون everything else excluded. Criteria A, to see represent a major depressive episode. Okay. D, the occurrence of the major depressive episode is not better explained by schizoaffective, يعني لازم تكون excluded, schizophreniform disorder, delusional disorder, or other specified and unspecified schizophrenia spectrum and other psychotic disorders. يعني in other words, all of these have to be يعني excluded, ما تكونش موجودة عند البيشنت تبعنا هذا. وإي there has never been a manic episode or hypomanic episode. لأنه زي ما حكينا when we are talking about major depressive disorder we are talking about إيش صحيح a unipolar process. There is no bipolarity being major depressive disorder. In order to يعني make this diagnosis MDD, there has never been a manic episode or a hypomanic episode. etiology زي ما حكيت لكم مش مطلوبة منكم، اقرأوها هاي قراءة هيك يعني تثقيفية لكم انه واتيرز وشو الاشياء اللي بتلعب دور بالمود ديس اوردرز. ما راح اركز عليها لكم بالامتحان. epidemiology prevalence of major depressive disorder 10 ل 15%. and male to female ratio وجد انه ladies they suffer more. Mean age of onset of major depressive disorder is 40 years, with 50% of patients having onset between 20 to 50 years of age. There was no correlation has been found between major depressive disorder and socioeconomic status, and more common in unemployed people, 3 times more likely يعني عند unemployed or divorced إنه they develop major depressive disorder. Patients with OCD, borderline, and histrionic personalities are at greater risk of developing major depressive disorder. Risk factors for depression in women. هاي ركزوا لي عليها. 3 or more children under the age of 14 at home. Not working outside home. Lack of confining relationships. And to lose the mother by death or separation before the age of 11 years. وجدوا إن هدول الفاكتورز they contribute as serious risk factors for ladies to develop depression. البروجنوسيس هذول برضه ركزوا لي عليهم. في عندنا good prognostic factors، شو الأشياء اللي بتخليني أفكر بأنه هذا المريض اللي أمامي أوكي هو عنده depression لكن his prognosis will be good. وفي عندي another patient برضه depression لكن his prognosis will be poor. good prognostic factors abrupt or acute onset. 2 severe depression. 3 typical clinical features زي اللي حكينا عنهم فوق. 4 well-adjusted premorbid personality. And 5 good response to treatment. بالنسبة للpoor prognostic factors اللي هم أولاً double depression راح نحكي عنها لاحقاً شو هي double depression. 2 comorbid physical diseases, personality disorders or alcohol dependence. 3 chronic ongoing stress. 4 poor drug compliance. 5 marked mood incongruent features. حكينا عنهم الcongruent والincongruent mood والaffect سابقا. هذول ركزوا لي عليهم. Why is severe depression considered a good prognostic factors؟ بعدين نحكي. بعدين اتذكر سؤالك وسألني إياه في النهاية. هسه بدنا نحكي عن المانيا أو المانيك إبيسود. بالنسبة للدي اس ام 5 criteria للمانيك episode, a distinct period of abnormally and persistently elevated, expansive or irritable mood. It has to last at least 1 week and 3 or more of the following symptoms أو 4 of these symptoms if the mood is only irritable يعني not elevated not expansive only irritable بدنا 4 لكن إذا كانوا الثلاثة موجودات elevated expansive و irritable sorry بدنا 3 of these of the following symptoms. أولا inflated self-esteem or grandiosity, decreased need for sleep. 3 pressured speech or more talkative than usual. 4 flight of ideas or racing thoughts. 5 distractibility. 6 psychomotor agitation or increase in goal-directed activities. 7 excessive involvement in activities that have a high potential for painful and negative consequences. For example, overspending أو sexual indiscretions. It has to cause marked impairment in occupational functioning, in usual social activities or relationships. Oh, it has to necessitate hospitalization to prevent harm to the self and to other people. And of course زي ما نحكي في كل أمراضنا بالكريتيرياز بأنه it has to be not due to substance use or abuse. For example, drug abuse, medications, other treatments, or a general medical condition. احنا فوق حكينا عن المانيك episode، هسه بدنا نحكي عن الهايبومانيك episode. It's a distinct period of abnormally and persistently elevated, expansive or irritable mood and abnormally and persistently increased activity or energy, which has to last at least 4 consecutive days. هناك بالمانيا أسبوع at least، هنا at least 4 days, and present most of the day nearly every day. B. During the period of mood disturbance and increased energy and activity, we need برضو 3 or more of the following symptoms وأيضا 4 or more if the mood is only irritable, have persisted, represent a noticeable change from usual behavior, and have been present to a significant degree. هدول هم برضو زي المانيا inflated self-esteem or grandiosity, decreased need for sleep, more talkative than before, أو flight of ideas or subjective experience that thoughts are racing. 5 distractibility, يعني in other words attention too easily drawn to unimportant or irrelevant external stimuli as reported or observed برضو. 6 increase in goal-directed activities either socially, at work or school, or sexually, أو psychomotor agitation. و7 excessive involvement برضو in activities that have a high potential for painful consequences اللي هي برضو زي هناك إنه engaging in unrestrained buying sprees و sexual indiscretions or foolish business investments, usual or pressure to keep talking. C. The episode is associated with an unequivocal change in functioning that is uncharacteristic of the individual when not symptomatic. يعني في عندنا change بالfunction. D. The disturbance in mood and the change in functioning are observed by others. يعني مش بس هو حاس، لا الباقيين بيلاحظوا إنه في عنده something abnormal. E. The episode is not severe enough to cause marked impairment in social or occupational functioning or to necessitate hospitalization. هنا كمان هي فرق عن المانيا. هناك حكينا بدنا أسبوع، هنا 4 أيام. هناك حكينا إنه في marked impairment بالسوشيال والoccupational يعني كل areas of life. هنا ما فيش يعني it's not severe enough to cause marked impairment. لكن it is observable that the person is not doing well. بالإضافة اللي حكينا إنه المانيا it necessitates hospitalization لما كانوا يجوني مرضى with خلص يعني a manic episode with full criteria على العيادة، خلص الموضوع كان منتهي لأنه بدهم دخول، يعني no way إنه يروح يكمل علاجه في البيت في حالة الأكيوت مانيا. في حالة الهايبومانيا no it's not necessary to hospitalize، وبيقدر إنه يتعالج as outpatient. If there are psychotic features, the episode is by definition manic. هذا برضو فرق آخر بين المانيا والهايبومانيا. بالمانيا ممكن نشوف psychotic features واردة، مش إشي غريب. بالهايبومانيا مستحيل، لأنه إذا كان في psychotic features بطلت هايبومانيا، إحنا قاعدين نحكي ساعتها عن mania of that or this degree. If the episode is not attributable to the physiological effects of a substance اللي هم ال drug abuse, medications or other treatments. هسه نيجي نحكي سريعا عن bipolar 1 disorder. A. Criteria have been met for at least one manic episode. يعني لازم يكون في عندنا بالهيستوري at least one manic episode. ساعتها بنقدر نقول إنه we are talking about bipolar 1. B. The occurrence of the manic and major depressive episodes is not better explained by schizoaffective disorder, schizophrenia, schizophreniform disorders, delusional disorders, or other specified or unspecified schizophrenia spectrum and other psychotic disorders. In bipolar 2, A. Criteria have been met for at least one hypomanic. معناته البايبولر 1 لازم يكون في عندنا مانيا بالخلطة. بالبايبولر 2 مستحيل يكون في عندنا مانيا، قاعدين نحكي عن something less severe اللي هو الهايبومانيا. Criteria have been met for at least one hypomanic episode and at least one major depressive episode. هنا برضو ضروري إنه يكون في عندنا at least one major depressive episode. هناك مش شرط بالبايبولر 1، هناك one manic episode خلاص this is bipolar 1. هنا at least one hypomania وواحد depressive. B. There has never been a manic episode. هذا شرط أساسي ورئيسي. C. The occurrence of the hypomanic episodes and major depressive disorder episode is not better explained by برضو schizoaffective, schizophrenia, schizophreniform, delusional disorders, or other specified or unspecified schizophrenia spectrum and psychotic disorders. D. The symptoms of depression or the unpredictability caused by frequent alterations between periods of depression and hypomania, they have to cause clinically significant distress or impairment. هسه لما يجينا مريض على العيادة وبدنا نعرف يعني is this a unipolar depression؟ هو جانب depression، لكن بدنا نعرف are we treating a unipolar depression وفيش مانيا في الموضوع كلياته ولا راح يصير في عنا مانيا في الموضوع، ولا this is a bipolar 1 أو bipolar 2 حتى that هسه has come to us with a depressive episode. ففي clinical features predictive of the bipolarity of the disorder، هذول ركزوا لي عليهم كمان ضروريات. early age of onset بيحكي لنا عن bipolarity أكثر من unipolarity. Psychotic depression before the age of 25, postpartum depression, rapid onset and offset of depression أقل من 3 أشهر, recurrent depression كررت أكثر من 5 مرات, seasonality على الفصول بتيجي خاصة الخريف وربيع, bipolar family history, hypomania associated with antidepressants, يعني سابقا كان عنده depression تعالج أخذ antidepressants صار عنده على أثرها hypomania. هذا بيحكي إنه we are talking about a bipolar process. Repeated at least 3 times loss of efficacy of antidepressants after initial response. Epidemiology bipolar. Prevalence of bipolar is 1 to 2%. Lifetime prevalence of bipolar at first degree relatives is 4 to 18%. Major depressive disorder in first degree relatives من 9 ل 25%. Bipolar has equal male to female ratio. Manic episodes are more common in men, while depressive episodes are more common in females. Mean age of onset of bipolar disorder is 30 years, while the age of onset of bipolar can be as early as 6 years of age, ممكن إنه يحدث في أي فترة لغاية 50 years of age. Average patient has 9 relapses during his lifetime, which is terrible. Schneiderian first rank symptoms occur in 15 to 20% of episodes of mania, which have shorter duration and changing in content will improve rapidly. هسه كان في عالم ألماني اسمه كورت شنايدر حط 11 سيمتوم كلهم سايكوتيك سيمتومز، وسابقا كانوا يستخدموا لتشخيص السكيزوفرينيا. كان أي واحد فيهم إذا وجد عند المريض كان كفيل بأنه خلص يعني ينتهي الجدل وينقال إنه this is schizophrenia. لكن لاحقا لاقوا إنه لا، كانوا يشوفوا هاي السيمتومز ويطلعوها من عند مرضى الباي بولر، فلذلك بتصير هي يعني أنا حطيت هاي النقطة إنه من 15 ل 20% بنلاقوا الشنايدرين first rank symptoms عند جماعة الباي بولر. Bipolar I disorder is more common in single or divorced people, and this may reflect the early onset of the disorder. A higher than average incidence is found in the upper socioeconomic groups. frequent comorbidities مع bipolar اللي هي substance misuse و anxiety disorders. والرابid cyclers، شو هم الرابid cyclers؟ هي أنا حاطها بين قوسين اللي هي they have 4 or more episodes per year, are more common in أولا females و those with hypothyroidism. 3 alcohol and substance misuse disorder. من 13 ل 30% of bipolar affective disorder patients are rapid cyclers اللي بينتموا لهاي المجموعة. They have 4 or more episodes per year. 20% of these people of rapid cyclers are induced by antidepressants. يعني بمعنى آخر iatrogenic، بمعنى آخر misdiagnosed or mistreated by doctors. About 5 to 10% of patients with initial diagnosis of depression, they will have a manic episode 6 to 10 years after the first depressive episode. هنا هي عشان هيك الدكاترة مش دائما يعني بيصيبوا البولزاي، خلينا نقول بموضوع الدياغنوسيس. يعني بيجي البيشنت ما كان في previous history of manic أو hypomanic، بشخصوا بديبريشن، ببلشوا يعالجوا في الديبريشن. ممكن ياخذ البايبولاريتي to kick in. It might take 6 to 10 years after the first depressive episode. Well, the mean age for this switch is 32 years and is often occurs after 2 to 4 episodes of depression. هسا أنا حكيت لكم فوق عن الشنايدريان first rank symptoms اللي بنلاقيهم لغاية يعني 20% عند مرضى البايبولر، واللي كانوا باثوجنومونيك للسكيزوفرينيا. هدول حفظ وركزوا لي عليهم، راح أسألكم فيهم. ما راح أقرأهم أو خلينا نقرأهم سريعا. Audible thoughts اللي هن voices speaking out his thoughts aloud. 2 voices arguing يعني referring to the patient in third person. Voices commenting on one's actions. Thought withdrawal, thought insertion, thought broadcasting, made volition, made affect, made impulses. Somatic passivity اللي هي experiencing externally controlled body changes. 11 delusional perception. هذولا حفظ ركزوا عليهم. etiology برضو مش مطلوبة منكم. سريعا pharmacological treatment of bipolar. التريتمنت اوف بايبولر بنقسم لقسمين. تريتمنت بيكون بفتره الاكيوت مانيا بالاكيوت ريلابس، وفتره لما يكون مريضنا واصل لمرحله الريميشن وطلع من المستشفى واموره كويسه. there are يعني some يعني differences between these two strategies of treatment. بفتره الاكيوت مانيا we usually give atypical antipsychotics اللي هم مثلا olanzapine, risperidone, quetiapine, ziprasidone واريبرابرازول. ممكن نعطي typicals لكن هسه ما بنستخدمها إلا في حالة إذا كان مريضنا غير متعاون وبنعطيه إياها على شكل injections اللي هم الهالدول والكلوربرومازين. And of course mood stabilizers lithium, valproate and carbamazepine. بفترة المينتيننس أو الريميشن lithium هو الجولد ستاندرد أفضل إشي. الفالبرويت برضو is a very good choice و يعني very frequently used. carbamazepine ولاموتريجين. It is generally clinically appropriate to initiate prophylactic treatment. أولاً, after a single manic episode that was associated with significant risk and adverse consequences. 2. In the case of bipolar 1 illness, 2 or more acute episodes, أو 3. In the case of bipolar 2 illness, أو significant functional impairment, frequent episodes, or significant risk of suicide. بالنسبة للbipolar depression, we treat it with SSRIs combined with an atypical antipsychotic. The best combination لغاية الآن يعني حتى in books is fluoxetine given with olanzapine. يعني these are the best augmentation drugs for bipolar depression. Of course, we give lamotrigine as a mood stabilizer. We can give, instead of olanzapine, low doses of ziprasidone. And of course, we always have the ECT as a choice on our table. خلينا يضل دقيقتين. هسه ببعث لكم لينك جديدة بحكي لكم سريعا عن المود ستابلايزرز وبعدين انتم بتبلشوا تحكوا لي عن سيميناراتكم.